In 1954, Congress passed Section 105, which simply put enabled the federal government, Procter & Gamble, and General Electric to be self-insured and allowed them to deliver the benefits to the employees still tax-free like they were accustomed to since the 1940s when group benefits were put in place.
Section 105 says that employer-sponsored health benefits are deductible to the employer and they're not taxable to the employee. It's been the foundation of employee benefits since 1954, and what it does is it lets employers reimburse employees directly for those benefits rather than having to finance it through insurance.
When I first heard this idea, I had the same reaction that many of my clients have, is that the savings seem too outrageous and unachievable. After doing the research on the Section 105 plan, my research led me to believe that the savings are not only achievable but very realistic. It's changing the way people buy insurance and health insurance, not necessarily eliminating coverage. It's just how they structure it.
Before we met the ClaimLinks people and Total Benefits, the cost of our insurance was at a critical juncture. We were possibly looking at reducing the benefits drastically, and that would have put us in a competitive, uncomfortable position keeping good people. We saved about $100,000 first year and kept our benefits the same, which keeps our people happy.
You know, initially, you want the truth?
Yeah. Of course.
I didn't think that it would work. After a year, we saved over $18,000, which was half of what we were initially paying the year prior.
And you provided the same benefits?
Absolutely. In some cases, they were better.
We started with ClaimLinks in January 2006. The reason we went there is the amount we were spending is like $675,000 a year for no more employees that we had at the time. That was getting to be outrageous. After about 3 or 4 months, they had projected that we would save about $290,000 by the end of the year. I immediately wanted to know what they'd been smoking and drinking. But lo and behold, by October, it looked like that was going to come true.
The resistance from the agents comes from the potential for a lack of revenue on their part. Obviously, if you reduce the premiums, generally they're going to take a pay cut. But I also think that there's a lack of education. They don't understand the tax code, specifically in this case, Section 105. So they're not up to speed on the tax ramifications of making this type of plan change.
Well, the biggest problem with health insurance is the way it's distributed. The agents who sell health insurance look at every employee benefits problem as something to be solved with health insurance. You've heard the saying, if all you have is a hammer, everything looks like a nail. Well, with health insurance, every employer looks like a candidate for traditional group health insurance. The problem with that is it's usually the most expensive way for employers to finance their benefits, and in this economy, they just can't afford it anymore.